Do people experiencing psychosis actually know they have it? The answer is more complex than a simple yes or no. For up to 98% of individuals with schizophrenia, a primary symptom of their illness is a profound inability to recognize it. This isn't rare. It affects around 60% of people with schizophrenia and 50% with bipolar disorder. This isn't stubbornness or denial. It's a neurological condition called anosognosia, originating in the brain itself. Ahead, we will show what anosognosia is, why it happens, how it affects people, and what can be done to help. First, what is insight in this context? It's the capacity to understand you have an illness and that you need treatment. This awareness isn't an all-or-nothing switch. It exists on a spectrum, with some having full awareness and others none at all. To be clear on the difference, denial is a psychological defense. Anosognosia is a neurological deficit. The brain's self-assessment machinery is impaired. From the person's viewpoint, their beliefs are completely real and logical. They genuinely believe they are not ill, and to them, we are the ones who are mistaken. So, anosognosia is not a choice or an attitude. It is a clinical symptom of the illness itself. It's a brain-based inability to perceive the illness. But what is actually happening in the brain to create this blind spot? Soon you'll find out why a person cannot see what seems so obvious to everyone else. A major reason is the cognitive deficits that often come with psychosis. Issues with abstract reasoning make it hard to step back and analyze one's own thinking. Another factor is the sheer power of the symptoms. If a hallucination feels 100% real, your brain accepts it as reality, not as a symptom. The brain isn't just presenting false information, it's presenting it as fundamental truth, making it nearly impossible to question that truth from the inside. Imagine everyone you trust insists you were awake all night, but you remember dreaming. The world tells you your core experience is wrong. This is the conflict they face. So, it's a combination. The brain's tools for self-reflection are impaired, and the symptoms feel too real to be questioned. This is a failure of brain function. Now that we understand the internal why, what does this look like from the outside? What are the real-world signs and consequences of this condition? Family and friends are often the first to notice early warning signs, such as social withdrawal, new and intense suspicions, or a drop in personal hygiene. A critical indicator is a noticeable decline in functioning. This might mean struggling to hold a job, failing classes, or being unable to manage daily tasks. When help is offered, it's often met with confusion or resistance. Because they don't believe anything is wrong, the suggestion to get help can feel like an attack. This is the most dangerous consequence of anosognosia. It is a primary driver of treatment non-adherence, which often leads to relapse and a worsening condition. This appears to be a straightforward biological issue, but is it ever more complicated? Could a person's feelings play a role in their lack of insight? Yes. A diagnosis of psychosis carries immense stigma and can be terrifying. Sometimes what appears to be a lack of insight is also a rejection of a painful label. Awareness can also fluctuate. A person might have moments of clarity where they understand their illness, followed by periods where they have no insight at all. This is why some clinicians suggest changing our language. Disagreement respects the person's reality more than lack of insight and can open a conversation. Psychosis does not happen in a vacuum. It can be a reaction to extreme life stress or trauma, adding another layer to a person's path to understanding it. So we have a neurological condition, layered with psychological complexity. Given all this, what is the path forward? How can we actually help? Here is the key takeaway. If anosognosia is a neurological symptom, then treatment refusal is not a choice. It is a direct manifestation of the illness itself. This is why our approach matters. By shifting our language to disagreement, we can use compassionate communication to build the trust that serves as a bridge to treatment. Recognizing that insight fluctuates means we must be ready to act during those moments of clarity. Early intervention can help extend these periods of awareness. The solution, therefore, is a combination of medical treatment and deep empathy. It is about treating the brain while connecting with the person. So, do people with psychosis know they have it? Often they do not, and this is not a personal failing. It is a core brain-based symptom of the condition itself. Fortunately, this lack of awareness is not always permanent. Effective treatments like medication and cognitive therapy can help the brain heal, allowing insight to grow. For families, this knowledge can transform frustration into compassion. For those experiencing it, know that recovery and understanding are possible with the right support. Understanding anosognosia is a massive step in destigmatizing psychosis. Share this video to help spread awareness and foster a more compassionate world.